Hey, welcome back, everybody. It's time again for another episode of Health Talks with Dr.Trinh. The one show, the only show that shows you the path to a healthier life, one conversation at a time, with our health expert, the one who's always healthy, Dr. Trinh. Welcome, sir. Are you always healthy? You should be always healthy with all the stuff you do here.
Absolutely not sure about that. I love In-N-Out burgers.
Okay. All right. Well, who did you bring? Here's a topic that's in the news all the time, and you've talked about many times before: equity and diversity in healthcare, particularly when it comes to minority communities. Everybody doesn't get the same thing.
Yeah. It's I am happy to introduce you guys here to Ronda Smith, Executive Director of the California Black Health Network. Been around, I just found out, for like 40 years. Wow. And then a new organization, actually, founded by Renarda Jones, Diverse Research Now, and who also has a mission for diversity, specifically for clinical trials with that. And so, guys, welcome. We are happy you're here, OC Talk Radio, and maybe just introduce yourself and go from there.
Renata, why don't you go first?
Okay, I'll go first. Yes, I am Renarda Jones, founder and executive director for Diverse Research Now. We are a nonprofit that is addressing diversity in clinical trials by offering unique programs and services to support diverse individuals through clinical trials. We also love educating them about clinical trials. So we are a 501c3 since January last year. So yes, we are brand new, but we're doing a lot of work. So we're in it for the long run.
Yeah, thank you. So yes, Renata, I want to commend you on the progress that you've made since we first met back in October last year, I think it was. So great to see all the things that you've done to really, get your organization's name on the map and get more involved in making sure our community participates in clinical trials. So kudos to you. So I'm Ronda Smith. I'm the executive director of the California Black Health Network. We are a 40-plus-year-old organization that works to advance health equity for all Black Californians. And so we get involved in outreach and education, policy and advocacy work, as well as programmatic work to try to move the needle and ultimately close the gap in health disparities and the 5.5-year plus gap in life expectancy of Black Californians compared to the state average. So happy to be here today, and thank you for the opportunity.
5.5-year longevity gap.
Yes.
Between Blacks versus whites.
Well, actually, when you look at that specific comparison, it's actually greater. So that 5.5 plus years is actually the state compared to the state average. So when you break it down and look at the AAPI community, it's about 10 years, close to 10 years. When you look at Blacks compared to whites here in California, I believe that's about 7.
That is a problem.
Yes.
I always realized it was an issue with equity, fairness, access to healthcare, but I didn't realize it was a 7-year longevity gap here in the state of California.
Yeah, and if you look at, there's the whole thing about your zip code matters. Where you live matters. And we know that, unfortunately, your zip code is an indicator of not only the quality of life, but also the length of life. So if you were to look at, even compared to like Beverly Hills versus Compton or even Long Beach or San Pedro, you'll see a stark difference in life expectancy based on those zip codes.
That's alarming.
Yes, it is. very alarming. But, we are working to try to close that gap and address those issues. One of the ways that we are doing that is we started a health equity advocacy training program, or we call it HEAT for short, because we want participants to go back to their respective communities and turn up the heat and cause some good trouble. And so we want to know that our community, I should say, we want our community to know that they have a voice and they can actually amplify that voice and influence policy and advocate for the resources and issues to address the issues that exist in their community. But I think all too often we're believed or conditioned to think that our vote doesn't matter, our voice doesn't matter, so we don't participate and we don't engage, and that's the worst thing that we can do. And so, those who make the most noise gets the greatest attention. So I think, we hope to see, changes happen locally once our participants go back to their respective communities and maybe even consider running for local office, right?
I love it.
Nice.
I love it.
Yeah.
Renarda, tell us a little bit about your background. I mean, how did you end up with this passion about clinical trials and all that?
Well, I started just out of undergrad into becoming a research assistant. So I started in Alzheimer's disease research, Alzheimer's disease research. And I had the opportunity to go into the community. I am from Chicago, so that's where I was going into the community at. And my PI at the time, which is a principal investigator of the study that I was working on, she really loved going into the Black communities. And so I had an opportunity to go into the communities with her. And that's where I really learned about like the hesitancy of us being involved in clinical trials. They, of course, these were older Black Americans, and they were okay with us coming in, talking with them, and maybe getting involved in observational studies. But when it came to taking drugs and going a little bit further, there was a lot of hesitancy. So I became passionate then because I was in this field, and all my experience as the years went on, I understood how important clinical trials were. And so I wanted to bring this knowledge to my community, because I do believe that if we have the knowledge that Ronda is talking about, the knowledge of us having these disparities and what's really going on in science and healthcare and and how we can close these gaps, if they understood how we can do that, I believe that we can do it. They will get involved. So that's why we are sounding the alarm for sure in our communities.
And I just want to pick up on what you said. I actually didn't realize that you were doing Alzheimer's research. And, when we talk about disparities, we see dementia and Alzheimer's more prevalent amongst Black women when we look at what's happening in our community. So that research and participating in that research is really vitally important for our community.
Yes. So yes, diverse research now, this is one of our areas of focus, recent areas of focus. And so we are going to be creating tailored campaigns to divert Alzheimer's disease research in our community.
Yeah, and there's a member that I would like to connect you to. Sorry for that digression. She's also in this year's cohort for the HEAT program. Her name is Tia Delaney Stewart. She actually works for the Alzheimer's Association and leads their DEI work. So she's an African-American woman. I think you guys would really complement one another. And so I'll facilitate that introduction.
Thank you. Yes.
Sure.
Yeah. If you are, I looked at the statistics. If a Black person has double the risk of Alzheimer's as a white person.
Yes.
Not good.
Not good. Yeah.
Yeah. And I think a lot of it just has to start with education, right? And the awareness.
Yes. So, which is what part of the work that we do, like to Renata's point, knowledge is power, right? And if we don't know what we don't know, I mean, we can really kind of, not do what we need to do, for ourselves and our community. And so a lot of the work that we do under what's called the Health for Life Initiative, which is our major initiative to improve health literacy, is around improving knowledge about different health conditions, really helping people understand how they can prevent certain diseases from happening that are preventable, or if they're dealing with a chronic condition, how can they more effectively manage that health condition so that it doesn't progress to a worse state. So that's what we try to do. And, we really want to create a more empowered community of individuals and patients who understand what their patient rights are, who, are able to really communicate and have a conversation and dialogue and partnership with their healthcare provider, no matter who or what type of provider they're dealing with, know how to advocate for themselves and their loved ones, especially if they're faced with a serious health condition. And then also know that they should be participating in the decision-making for their care and know that they should be at the center of that. Because I say, in reality, Renarda knows this, like the big barrier to better health is racism, right? We are not going to eradicate racism in our lifetime, but I feel like if we empower individuals with the knowledge, skills, tools, and resources that they need to figure out how to make the healthcare system work better for them, then we can shrink maybe that big R to a little r, because when they show up, they'll show up in the right way and really are able to be more proactive and own that power and dynamic and respond more appropriately when they're faced with those situations.
Yep.
Love it. Ronda, are most of your events in person or online?
We do mostly online events. We are starting to do more in person, like our member networking. So we'll see Renarda next month when we're in San Diego a few times. But our member networking events are starting to happen in person. But most of our education events right now are virtual.
Got it.
So everybody can access them no matter where they live.
Yeah, exactly. Because if you're covering all of California, it's hard to do a lot of in-persons.
Yes. So we're a very lean team. So we don't have the resources to do all that. But we're small but mighty.
Love it.
Yeah.
Renarda, how do you get folks to build trust in research when they're like, am I a guinea pig? And, and the history of research in the Black community hasn't been a good history in the past. So how do you build that trust with what you're doing?
Yeah, it's community engagement. So you have to be out in the community. And this is our first, line of therapy when we go out there, like we have what we do is community engagement. So we have to be present in the community consistently. And you have to your message has to be the same, can't be changing up, you know what I mean? So this is how you build trust. This is how they see you constantly in the community. You have the same message. You continue to educate. It might take a while. Trust takes a little bit of time to build, especially after everything that has happened to our community. So that's one thing that our organization, we have a book club and we're reading about the immortal life of Henrietta Lacks. And in that book, Dr. Patillo was one of the doctors on her team of doctors. And he was really a protector of the family. Once everything happened, when the author came in to write the book, he really wanted to protect the family and make sure the author knew of how to go in and address them. But I really, in learning what he said to her, it really resonated with me in how we should approach Black and Brown communities in research, and how we have to be transparent. We have to be honest. We have to be sensitive to what has happened in the past. Let's not, you have to talk about it. Let's not just sweep it under the rug. Like, we have to address these things. And I believe if, we address these things and we're there present, consistently, then we can build some good trust over time.
Yeah, and you made a few good points. Yeah, so trust takes, being consistent, having a constant presence in the community, and talking to someone who looks like us is also helpful. And one of the things that we've done around educating our community around clinical trials is we've actually done two things. We actually had Dr. Kizzmekia Corbett participate in one of our health equity forums, especially during the time when COVID was more of a pandemic, because we really wanted to do our part to dispel some of the myths and misinformation that was circulating in the community around that time and give people an opportunity to ask questions directly from the person who was part of the drug development process. And so it was great. We had a few emails that came in after that said, I wasn't going to get the vaccine, but now after, listening today, I'm going to go out and get vaccinated. And that's exactly what we wanted. We want people to be, well informed so that they can make the right decision for them. We also have had members of the Henrietta Lacks family participate in our health equity forums. In fact, last year, we had the granddaughter, one of the grandsons of Henrietta Lacks, participate in a health equity forum around World Clinical Trial Day to really help our community understand the importance of participating in clinical trials, as well as learn more about, their grandmother's story. And so we felt if we had the family talking about this, then maybe it would, prove that things are okay. And the things that happened with the Tuskegee experiment and the Henrietta Lacks story and lots of other medical research atrocities in our history, don't happen anymore, and there are patient protections in place. And then they talked about what the family's doing now and how they are participating in the decision making for the HeLa cells and research.
This is so important. This is why we have our upcoming community clinical trial health forum. This is exactly what we're doing. We want to bring pharma face to face with community members to talk about concerns, ask questions, and really, this would be a great place to just get educated about, this field and what's going on. So, yes, and we have to do this all the time. So we're going to definitely plan to do this forum annually. Yeah.
That would be great. Maybe we can get Jerry to come out one year.
Yeah.
We can work on that. Yeah.
No, I love it. And of course, you both have a platform here at the Healthy Brain Clinic in Long Beach.
Thank you.
Absolutely welcome to do something on a regular basis here. Yeah, I just had a chance to, and Renarda was with me to speak at a Black church.
Okay.
Mm-hmm. The oldest Black church in Long Beach, right?
Yes.
Oh, wow.
Church in Long Beach, Second Baptist Church. And so we'll be back there doing more events. Long Beach is 50% between Black and Hispanics, 50%.
Okay.
Oh, wow.
Which is quite significant.
And I loved how receptive they were to us. They really loved our talk. I know I'm biased, but I left there feeling so empowered after that talk, Dr. Trinh, and I know that the others did as well. From them coming up to us and letting us know how much they enjoyed the talk. So yeah, we have to definitely do more of those.
Yeah, the education is missing in the community.
Yep.
It's a huge gap.
Yep.
Yeah, no, I know. And then unfortunately, the way the healthcare system is structured, we can't rely on providers to, give information that is important to patients in the time that they have to see a patient in an office-based visit, as you well know. Yes. So we have to find ways to make sure that they're getting the information that they need. And, something as simple as, one of the things that we're doing is, and I say California has great legislation that has been passed to improve access to care, improve quality of care. I mean, things like CalAIM and a few others. But I say, things fall short in the implementation of those policies because, again, like CalAIM, doctors are not going to educate their patients about what CalAIM is, what benefits they have now, because of how do they access those benefits. So part of our job and what we do around advocacy in our policy work is communicate with our community to help that kind of policy and legislation make sense. So we created what's called the policy rundown, which is our way of communicating to people in very simple terms. This is what it is. This is why you should care about it. Here are the benefits for you and your family, and this is how you access those benefits. So that's pretty much all people need to know. So we're going to be doing more of that to educate folks around, the Omnibus Act, right? The perinatal equity bill, CalAIM, and a host of other things that have come to the forefront here in California. So that's really important for our community to know, and that generally does not happen especially for communities of color.
Yeah, it's even for the average Californian, we have no clue what's out there, what's been passed, and it's even worse in the community of Black color. And so, yeah. How often are you doing these health equity forums? Is it monthly? Is it?
So the Health Equity Forum is really a venue or showcase for us to feature some thought leader, a subject matter expert in health equity, health disparities, and public health. So we do those about once a quarter. For the Health for Life programs, we do those more frequently. So again, we have one coming up next Thursday, as I mentioned before, around it's called Let's Celebrate Life in recognition of National Donate Life Month, and to really help educate our community about the importance of organ donation and transplantation, and especially important, like the risk of match is greater if there's someone who donates that looks like us. And, there's myths and misconceptions and misinformation about organ donation and transplantation too, especially when it comes to kidney transplant. So we really want to communicate the facts about that for our community so that they know and can participate. And for us, it's part of the equation to close the gap in health disparities.
Wow. Renarda, Diverse Research Now, there are a few programs under your umbrella. There's like the Study Buddy, and there are a few other things that you do. Tell us about those different programs.
Oh, we don't just want to bring our community to clinical trials and make them aware of them. We want to support them through the clinical trial. We do believe that this is going to help with just even getting them in the door, getting them enrolled, and then it will help with retention as well. So our first program is the Safe Space program, where we really come in and have a private space between us and the participant, learn a little bit more about them, educate them a little bit more about the clinical trial process, make sure they're comfortable with going through this process and they are well informed about the process. And so we educate in that space. And we, if we haven't identified trials for them that they might be interested in, we would help identify trials in that space and actually walk through that space with them, walk through that process with them. Even going as far as going over informed consents with them. Those informed consents are a lot, it's a lot of words. And so we'll help break down that informed consent with them. And these are things that they can do at the clinical trial sites. But again, to Ronda's point, sometimes they don't have time to really go to give the participant a lot of time to review these informed consents. So us as a third party coming in, it would be super helpful,
Right.
for make sure that they understand everything.
Yeah. And I think, sorry, go ahead. Yeah. I was going to say that, if we go one step further, right, I think it's important for our community to know that, say, if they're faced with a serious or advanced cancer diagnosis, and, all too often, I think communities of color here, you have stage 3 or 4, there's nothing I can do, right? That's not always the case, right? And so I think it's important for every patient and individual who may hear that or may know, that they have a more serious cancer diagnosis or any other life-threatening disease, that they can always ask the question, is there a clinical trial that I can get enrolled in when all other commercially available therapies don't work? They have the right to access that. And so they should know about that, and that it can be participating in a clinical trial can be a life-saving alternative. Not one that's going to bring harm to them, right?
that, oh my goodness, it just that you saying that, yes, I'm so passionate about this. So that our community doesn't know that. We don't know that clinical trials are an option. It's not something that we even think about. And that is what we're trying to change. We're trying to let the community know, like, hey, this is a valuable option. This is an option that could save a life. You'll save your life, save, future generations' life. You know what I mean? So so we want to educate them, and so we do that in our safe space. But then a little bit further, we have our study buddy program where we want to assign a buddy to the participant as they go through the trial. I don't know if you know, but some of these trials are very intense, and they have to go to all these procedures, assessments, and so as their buddy, we're just constantly checking in on them, again, consistently building trust. So we're constantly checking in on them, making sure they're good while they're in the study. This is definitely going to help with retention for sure, because that's also an issue with the trials. Once you get them in, sometimes
you have to keep them, yeah, right.
So we can get that data, so we can get to the end of the trial and see what is really going on.
Right. And there's tons of resources to support folks that do enroll or want to enroll. And we know sometimes transportation can be a barrier, especially if the clinical trial is at a different site than where their home location is. So there are organizations out there that will provide support, financial support for transportation and hotel accommodations and all of that. So
and a lot of the sites are doing that as well too. So that's always a question. See, sometimes they don't even know that they can ask that question.
Right.
I mean, the site should offer that, but sometimes they're not, they're not. So as us being in the room with them, because a part of the Study Buddy program is we go to visits with them. And so as experts, we know that that's an option, that could be an option, and we'll know to help ask that question.
Right.
And one day, I really hope that Diverse Research Now can help in that space as well, with like transportation with participants and things. So
absolutely.
Yeah.
It's transportation and getting to the office is a very important issue, especially in areas that are, not Irvine, California, right?
Right. Yeah.
Do you have any issues with that, Dr. Trinh, with your participants?
We do, and we do provide Uber transportation at no cost to all of our participants.
Awesome.
Yeah, including the first consultation where they're not even in a clinical trial, we still provide transportation. It's very important.
Yep, it is.
Yeah, I like the fact that this safe space program that you have allows folks to ask questions about research, because when somebody looks at an informed consent that's 30, 40 pages long, they're like, what the heck is this? Right? What's a double blind, right? What's a placebo controlled? And folks have no clue. They'll just sign at the end, right? But we need to break it down to really language that the average American understands, and not just, language that a research professional knows.
Right. And give them time to process all of that, they would need time to process what this means. And, so.
Yeah, I was going to say, yes. So I was thinking that earlier about interpreting like all the medicalese that, are thrown at patients, especially in this particular scenario, is very important. So explaining what certain terms mean, right? Because not the average person knows what a double blind or whatever, getting a placebo, what that means, right? So, this is part of improving health literacy too.
Yeah.
Or knowing that there's informed consent, right? That is like what you need as part of participating in a clinical trial. So
absolutely. So in your respective organizations, are you just educating on any particular health topics that stand out, or just the broad range of, health conditions?
Yeah, so we try to focus on the top 5 things that are impacting our community. And that is maternal health, cancer, chronic diseases, especially like diabetes. We know that our community, especially in California, has a higher rate of diabetes diagnosis, higher rate of pre-diabetes, and a lot of times people don't even know that they're pre-diabetic. And then when we look at diabetes-related deaths, and especially in Long Beach, when we look at the Black community compared to everyone else, we see a huge gap in disparities when it comes to diabetes-related deaths. And so we also look at rare diseases like lupus and sickle cell, and also end-of-life issues. So we cover the full spectrum so that we know, and our community knows kind of what is actually happening and what can be done in response to that.
Yeah. And we also want to cover the full spectrum as well. However, recently we have decided to begin focusing in on 3 top health conditions that we see that our Black and Brown communities are dealing with, which is Alzheimer's disease research, weight management research, huge right now, and mental health research.
Huge. And believe it or not, they're all connected.
Yeah.
Yes. Yeah. So, right. Obesity and diabetes. And even, there's been some research around the connection between diabetes and Alzheimer's. So,
Yes.
and, if we start with, obesity, I think we put a lot of blame and shame on people who may be carrying around extra weight, when really not all of that is kind of being overweight by choice. So obesity is a disease. So I think that's another connection point where we need to have a conversation outside of this, because there's some work that we're about to do in the obesity space.
Awesome. Yep. Let's do it.
That's huge. If you're diabetic, your risk of Alzheimer's is double
Right.
that of a non-diabetic.
Right. So if you kind of work backwards, right? And so we know, like, we see that, right? And we know diabetes, especially type 2, is more prevalent in the Black community. And we see, we know that there's a link between obesity and diabetes. And we know that, unfortunately, 3 out of 4 African-American or Black women are obese or overweight, mainly based on body mass index. So if you kind of start here and work backwards, then, we can see where the root causes are. And, those are things that we can definitely focus on preventing and building more awareness around how you can prevent those things from happening.
Absolutely. As a matter of fact, if you are overweight, you have increased your risk of 13 cancers.
Wow.
Yeah. And heart disease, and hypertension, and a host of other things.
And the problem is, this is not addressed at the primary care office, because the doctor's just going to say one sentence: lose weight.
Mm-hmm. Right. Yeah.
Where do you start? What do you do? Right. And I don't always blame the doc, because they have like 10 minutes with you. Right. They're given 15 minutes per patient, 20 minutes per patient. And so the time to discuss prevention isn't even there.
Right. Well, the way the healthcare system doesn't focus on prevention, it's more like sick care as opposed to healthcare, or wellness care. Right. And so, yeah, if you really think about, people are always complaining about the cost of healthcare. Right. And most of that is attributed to chronic diseases. Most chronic diseases are preventable. So if you focus on that, right, you can save, theoretically, right, you can save costs within the healthcare system. But that's not how it currently works, unfortunately, or how people are incentivized and compensated. So until the healthcare delivery system changes and focus, my dream one day is that we will, well, I don't know if it'll happen in my lifetime, but that, primary care especially focuses more on precision medicine and prevention.
Absolutely.
And on that note, we are part of the NIH All of Us program. And so ultimately, that is what the goal is for all of us, is to apply precision medicine to healthcare. And so, so we're going to do our part to make that happen and explore what kind of policy opportunities there might be here in California, since we typically are on the forefront of what healthcare changes happen in this country. generally speaking, yeah. So
I'm one of the community advisors for the All of Us program at UC Irvine.
oh,
So
cool.
I
Okay.
love the program, and we brought in their speakers and
Yeah.
we've co-lectured together.
Oh, great. Yeah, we had Dr. Watson speak at our Health Equity Forum back in February for Black History Month about the All of Us program. So, and we're participating in a virtual conference coming up too.
Awesome. And we promote All of Us all the time. And one of our partners is San Diego Blood Bank, who is collecting the blood for all of us. I think in partnership with Scripps, or is it, I forgot which hospital it is.
We should do a podcast together with All of Us.
I agree.
Yeah, I think so too. Yes.
I'll bring the folks at UC Irvine in who are part of the All of Us program, and we'll do a fun little podcast and promote it.
Yeah, that would be great. I think it would be good to do a community event also.
Yes.
For all of us. And especially, part of what we're expected to do is focus more on, I won't say the elderly population, but the 50 plus population.
Yes.
So I think it would be great, given your work and what Renarda's doing and what we're doing, to have a community event focused on that, especially for that population.
Let's do it.
Yeah.
Last year I hosted probably 3 community events for All of Us, and their professors came and did the lecture, and it was a really good turnout, and we had a lot of folks signed up with that.
Great.
But would love to do it for the Black community, and we can certainly pick a church locally, perhaps. And
we can go back to, what did you call it? The
Second Baptist.
Second Baptist Church. Yes, we can go back there. Since you already have that relationship and they know you, I think engagement would be a lot easier.
Yes.
Yeah.
Absolutely.
Oh yeah, let's do it. I think there's a lot that we could do together. Yes.
Yes.
Yeah.
Wow. This is a conversation that is way too short. Let's do some follow-ups, conversations online. Let's host some events right here in Long Beach on a regular basis to build that trust, where both your organizations can come here, and we'll bring the folks here, and build some trust, and let us shorten that 7-year gap.
Yeah.
Yes, for sure. Yes.
That is just a crazy number. First time I've heard of it. And I bet you it'll be the first time most Americans have heard of it if we went and gave that number out. I mean, we've always talked about, equity, diversity, inclusion, but 7 years in longevity difference is shocking.
Yes. And then, nationally, COVID added about 2 to 3 years to that life expectancy number. We're still kind of waiting to get the data for California, but my suspicion is probably another 1 to 2 years to that 5.5. So
completely shocking. And yeah, we gotta be louder and do more activities and just dig into the community and get this awareness out.
Yep, I agree.
Yep.
All right, guys. It's so good seeing you again.
Yeah,
recording stopped.
Yeah. Yes. So actually, I have I'll be in Long Beach for someone's birthday celebration. I have to look and see when the date is.
Send me the date.
But it's during the day. So yeah, I'll let you know when that is. And then maybe you and I can meet in person when I'm there.
Yes.
And we can talk about all the great things we could potentially do together.
Absolutely. Yeah. I'm hosting at my office. I'm going to start hosting kind of like a lunch and learn or a brunch and learn on Fridays, where I'll invite the community, feed them, teach them something health education wise.
So here's something that I didn't say when you asked the question about doing in-person events. We are starting to do so one of the programs that we're going to be launching is in partnership with the California Healthcare Foundation.
Yes.
That's connected to their Listening to Black Californians research.
Yes.
And so we're going to be moving forward with the health education and health literacy component. And so we'll be doing a series of in-community events because so we want to, without being too cliche, meet people where they eat, shop, play, work, and slay, all of that. And so we started this conversation series. So like, for example, we want to go to barbershops and hair salons and do a series called Cuts and Conversations.
Wow.
We did a session in Sacramento a few weeks ago at a Black-owned wine bar. So that's Cocktails and Conversations. We want to do conversations with the congregation. So going to a church.
Yes.
And, you know, and then we're going to be doing a session at a coffee bar when we do our member networking event. So we're going to, that's called Coffee and Conversations. And then we want to do sessions with corporate ERG groups and affinity groups. So that'll be corporate conversations. So we could do one at your office, a conversation event, because we really want to help people understand truly how to make the healthcare system work better for them. And all those things that I talked about earlier about patient rights, how do you communicate with your provider, navigate through the healthcare system, advocate, and all of that is important for people to know.
I would be glad to bring in representatives of various pharma companies to be here in person, just to answer questions, chat, and build that trust.
Yeah, and we can get, I think, so probably more so from the healthcare system itself.
Yes.
For that kind of conversation versus pharma, but maybe pharma for another one.
Yes.
And I know that Dignity has a healthcare center in Long Beach, and
Moral Care is here.
And yeah, exactly. So when I'll let you know when that event is, or that I'm coming to Long Beach for, and then we can meet and talk about all these things.
Absolutely.
Renarda, we need to have a conversation too.
Oh yes, I was gonna say that your ideas about the conversation events. I'm planning one because we have a coloring book. We have a research and coloring book, and I'm gonna do a coloring chat.
Okay. Yeah, that would be great. Yes. So and then so Dr.Trinh knows Tia Stewart as well. And so I think she would be a great connection for you. And I'm waiting to hear back, but one of our board members works for ASI pharmaceutical company. And I've talked to her about getting their support to do a health equity forum or either a health live session next month for World Clinical Trial Day. So I'd love to have you participate, but I'm waiting to hear back from her because I asked her if they could also identify a speaker from the company that could participate.
Okay. They're one of our sponsors at the health forum.
Okay. So do you know Marissa? Is that who you work with?
No,
Marissa Daniel.
Oh, you know her.
Marissa, that's a different Marissa. No, Marissa Harris, I think is her last name, who is on our board. There might be a different Marissa, but that's the one that. So
someone different, but they're Eastside was very open to supporting our forum, so I'm sure they would.
Okay.
Yeah, I'm one of Eastside's advisor.
Okay.
So I'm on their KOL, key opinion leader. I'm also on Asuka's advisory board as well, and a few others as part of their KOL. So can definitely bring pharma on board if you need anything with that.
All right. So I'll have I'll follow up and let you know the date, and then we can meet in person. And then Renarda, if you want to schedule some time while I'm in San Diego to meet in person to talk about all of this, going forward. But I'll let you know what Marissa says about the event next month for World Clinical Trial Day. But I'll be in San Diego early on the 16th. So if you have time to get together.
Okay, yeah, we can do it before our event. Maybe talk.
Yeah. Okay.
Dr. Trinh, is this how do we end this? Is it?
Yeah, so they already stopped the recording, but you'll send us the link?
Yes. Paul, are you there? I think Paul is still around. But yeah, he ended the recording. So what will happen is we'll send you the link, and then we'll create a podcast out of this that will be on Apple Podcasts, Google Podcasts,
all
the different podcast channel. And
awesome. Yeah, that would be great.
Yeah.
Okay, well, thank you so much for the opportunity. Now it's on to the next,
Yes.
the next meeting. All right.
All right, bye,
Take care.
guys.
Have a great day. Bye-bye.
Take care. Bye-bye.